Hello friends, welcome to a new lecture today. I would like to discuss today about premature rupture of membranes. It is a topic of obstetrics. So this is premature rupture of membranes. Okay, before we go into the pathophysiology of premature rupture of membranes, I think I would like to explain about some terms about premature rupture of membranes. So just a minute. Yeah. So, if there is rupture of membranes, what is premature rupture? First, what is premature rupture of membranes? Premature rupture of membranes is rupture if rupture of membranes occurs before the onset of uterine contractions. Normally, the rupture of membranes should occur after the onset of uterine contractions, right? If this rupture occurs before the onset of uterine contractions, then we call it as premature rupture of membranes, right? So, if this premature rupture of membranes, if it occurs less than 37 weeks of gestation, after 37 weeks. First, let us start from term. Okay, if it occurs after 37 weeks of gestation, after or equal to 37 weeks of gestation, then it is called as term premature rupture of membranes. Okay, if this occurs between 24 to 37 weeks, then it is called as preterm premature rupture of membranes. If this occurs between 16 to 24 weeks, then this is called as mid-trimester or pre-viable premature rupture of membranes. So if you see, this premature rupture of membranes can be divided into three types based on the gestational age. It can be called as term premature rupture of membranes if it is if the rupture of membranes occurs more than or equal to 37 weeks. If this occurs in between 24 to 37 weeks, then it is called as term premature rupture of membranes. If it occurs between 16 to 24 weeks, then it is called as mid-trimester or pre-viable premature rupture of membranes. Now, what is pathophysiology of this premature rupture of membranes? So before we go into the risk factors, let us learn about the pathophysiology. So what is the pathophysiology of premature rupture of membranes? So before going into the premature rupture of membranes, first we should know about the membranes of the uterine sac, of the gestational sac. So the fetus and the gestational sac, these are, let me draw a fetus first. The fetus, it has a placenta, right? This placenta is attached to the uterus. Now, this fetus is surrounded by two layers of membranes. One, it is called as amnion. The second membrane is called as chorion. Okay, the inner membrane which you see, this is amnion, and the outer membrane is called as chorion. Okay, normally in the early gestational age, in the early stages of gestational period, you will see that if this is the chorion and this is the amnion, so between the amnion and chorion, you will see presence of some connective tissue. There is a spongy connective tissue which is present between the amnion and chorion. Okay, slowly as the gestational age advances, there is remodeling of this connective tissue. Normally the amnion and chorion are same, there is no difference in it, but there is remodeling of this connective tissue along with the membranes. So these membrane remodeling occurs. How does this membrane remodeling occurs? What are the remodeling changes that occur? So if you see, as the gestational age advances, there is increased production of matrix metalloproteinases, cytokines and collagenases. Okay, these will degrade the collagen. and intracellular matrix. Because the collagen and intracellular matrix which is present is degraded, this will weaken the membrane. Okay, so this is what happens in premature rupture of membranes. Now, what are the risk factors which causes premature rupture of membranes? Any risk factors which will increase this which will increase the production of these collagenase, or increase in production of matrix metalloproteinases, or increase in production of cytokines, these will cause weakening of membrane. So let us learn about the risk factors of premature rupture of membranes. So what are the risk factors of premature rupture of membranes? So the risk factors include, first, so there are many risk factors. Whatever be the risk factors, there should be increased imbalance between the matrix, there should be increased matrix metalloproteinases, and there should be increased cytokines. And one more thing, there are also some substances which will decrease the collagen degradation, and which will increase the connective tissue membrane. So those are called as TIMPs, tissue inhibitors of matrix metalloproteinases. Okay, so these will inhibit this degradation. So on a whole, whenever there is imbalance between these metalloproteinases and tissue inhibitors of metalloproteinases, and there is increase in matrix metalloproteinases or cytokines or collagenases, only then there is a chance of premature rupture of membranes. Now, let us learn the risk factors of premature rupture of membranes. So, the risk factors of premature rupture of membranes include, first, the first important risk factor is over distension of the uterus. So, whenever there is over distension of the uterus, what is happening if there is over distension of uterus? First, what are the cases where there is over distension of uterus? In the uterus, in the gestational sac, there is baby, and also there is amniotic fluid. Whenever there is increased amniotic fluid, that will cause over gestation of uterus. So that is polyhydramnios. Okay, and whenever there is increased baby, the baby should be bigger. Even then, there can be over distension of uterus. So that can be in baby is bigger, so it can be in macrosomia, or not one baby, but if there are many babies, okay, that is in multifetal pregnancy. So these are the conditions where there is over distension of uterus. Okay, so what happens if there is over distension of uterus? Whenever there is over distension of uterus, there is increased intrauterine pressure. There is increased intrauterine pressure. This increased intrauterine pressure, this will act as a mechanical force, and this will cause membrane rupture. Okay, this is one thing. The other risk factor is presence of urogenital infections. Whenever there are urogenital infections, any type of infections, these infections will increase cytokines, and also it will cause imbalance between matrix metalloproteinases and tissue inhibitors of matrix metalloproteinases. So these inhibitors include mainly these infections include chlamydia trachomatis, trichomonas vaginalis, bacteria vaginosis, group B streptococcus, and Neisseria gonorrhea. There are also some connective tissue disorders. In these connective tissue disorders, there is inherited defect in collagen synthesis. Even these can cause premature rupture of membranes. So this is like Ehlers-Danlos syndrome. So these are the main risk factors. There are also other risk factors of premature rupture of membranes.